Okay, today I'm going to talk about a subject that should be of interest to anyone who uses oral anabolic steroids. There's various types of oral anabolic steroids: Winstrol, Anavar, uh, Anadrol 50. I'm not going to get into all of them, but the main problem with oral anabolic steroids is the fact that they can accumulate in the liver. In fact, that's why they work so well. If you were to ingest testosterone orally, most of the testosterone would be degraded by enzymes in the liver and would have very little activity. Now, what they did with oral anabolic steroids, when they were first developed, the structure was manipulated by steroid chemists to resist premature degradation in the liver. This extended let's say the active life in the body of oral steroids, which is good because it made the anabolic activity much greater, but you paid a price with that, and the price of that was the fact that the reason that the oral anabolic steroids work so well is that this structural changes prevented them from being prematurely broken down in the liver. As a consequence, the oral steroids tend to accumulate in the liver, and when they do so, that's when problems can arise. In fact, the main problem with oral steroids is their effect on the liver. Secondarily, their effect on blood lipids such as HDL, but that's another subject I'm not going to get into now, but we're going to talk about a little bit about oral steroids in the liver and a particular supplement that a lot of people don't know about that can really help prevent liver problems in those who take oral steroids, especially those who take larger amounts of oral steroids. In fact, I feel that this particular supplement, anyone who uses oral steroids should keep this supplement handy. It might be very useful. I will tell you that the first indication of stress in the liver induced by oral anabolic steroids is an elevation in liver enzymes. What's going on there is that your liver is getting inflamed, and the inflammation is causing a subtle damage to the liver cells, and this is reflected by a rise in liver enzymes. So, of course, anyone taking oral steroids should have regular blood tests, including what they call a liver panel, where they do a blood test and they check the levels of your liver enzymes. If they're particularly elevated, that means there's a lot of stress being induced in the liver by the oral steroids, and you need to cut back. But you can also prevent that largely by taking the supplement I'm about to talk about. But before I do, let's talk about what causes the inflammation in the liver. Why do you get this liver inflammation when you take oral steroids? What happens is the liver produces a substance called bile, which is made largely from cholesterol. In fact, the only way the body can get rid of cholesterol is by degrading it into bile. High-density lipoprotein is produced in the liver, circulates in the blood, locks onto excess cholesterol, carries it back to the liver, where the cholesterol is converted into bile, and that's how the body gets rid of excess cholesterol, because cholesterol cannot be burned like fat, can't be oxidized. It can only be converted into bile, and bile can be excreted. Now, one of the main functions of bile is it's an emulsifier. It will take, let's say every time you eat dietary fat, the fat as the fat goes through digestion, the fat globules, let's say, or the smaller, as the fat breaks down, the fat globules are too large for lipases, fat digestive enzymes, to act on. So the fat globules have to be reduced in size, and that's where bile comes in. Bile is able to emulsify the fat, reduce it in size enough where the lipase or fat digesting enzymes can now act on the fat, the dietary fat, and digest it. So you need bile basically for fat digestion, along with, of course, lipases, which are fat digesting enzymes. Now, here's where the part related to steroids comes in. As I said, bile is produced regularly in the liver, and it circulates through the liver through certain channels, and then it basically travels through the liver in these channels, and it's sent to the gallbladder. The gallbladder is the storage site for bile produced in the liver, and every time you eat fat, there's a message without getting into it. It has to do with certain other peptides, and I'm not going to get into all that. But the point is that your body can sense when you eat fat. The gallbladder is stimulated, kicks out some bile, helps you to digest the fat, right? Now, again, though, the liver produces the bile, and it travels through these channels. Now, what happens when you take anabolic steroids, oral steroids in particular, is that you get this liver inflammation from the steroids, which causes basically inhibits the movement of bile through the liver. And when that happens, you have a condition of a backup of bile in the liver, or an accumulation. It's called cholestasis. Now, as the bile accumulates in the liver, it causes even more liver damage. Eventually, it'll cause the breakdown of hepatocytes, which are liver cells. Now you're in real trouble, because now it's actually starting to break down the liver. The liver cells. So again, this is called cholestasis, and it's probably the most common side effect when you use large oral doses of steroids. Now, what can you do about that? This is the kind of main point of this video. There is a supplement. It's actually a substance made in the body. It's a little tough to pronounce, so I'm going to have to take my time with this. It's called tauroursodeoxycholic acid, known by the acronym of TUDCA, TUDCA. I might be mispronouncing that, but I see it as TUDCA, TUDCA. TUDCA, again, is made in the body. The original bile acid, one of the originals, is actually ursodeoxycholic acid. What TUDCA is when it gets in the production of UDCA, which is, I know this is, I'm sorry, it's a little technical, I'm trying to go slow. In the production of urodeoxycholic acid, taurine, the amino acid taurine, is added to the UDCA, and that becomes TUDCA. TUDCA is a lot more efficient than UDCA. But what you have to know is TUDCA is more efficient because it thins out the bile better. In other words, it works, has a thinning effect on the bile, which allows the bile to move more efficiently through the liver, so it doesn't back up and cause the liver damage that would normally accrue when you take in large amounts of oral steroids. As I said, TUDCA is a bile salt. Again, it's found naturally in the body. When regular bile salts reach the intestines, they're metabolized by bacteria in the small intestine into UDCA, which is, again, that's ursodeoxycholic acid, and then later it becomes the UDCA becomes bound to a taurine molecule to become TUDCA, TUDCA. It's commonly referred to, again, it's a derivative of secondary bile salts secreted from the liver. Blah, blah, blah. I already talked about that. Both of these, the molecules, both UDCA and TUDCA, they're known as hydrophilic bile acids. What does that mean? That means they attract water. And basically what they do is they thin out the bile and permit greater movement of the bile, so the bile doesn't get thick and back up. In other words, it kind of keeps the bile moving. If the bile keeps moving, it has less of a tendency to accumulate in the liver and cause liver damage. It's also found, it's like I say, it's a water-soluble bile salt, in contrast to regular bile salts, which possess both water-soluble and fat-soluble. And by doing that, by the bile salts conferring water-soluble and fat-soluble effects, it has like a detergent action. In other words, it helps to, again, as I said earlier, reduces the size of fat globules, and emulsifying fat helps you with fat digestion. The bile salts also have been found to have beneficial metabolic effects, such as reducing insulin resistance and diabetes, and also they can provide some neurological protection. I'll talk about that in a minute. But the main usages of TUDCA beyond the liver are preliminary, whereas usage of TUDCA for helping an already harmed liver is quite reliable. TUDCA is actually used in hospital settings for treating cholestasis. It's one of the two main drugs. If you go in the hospital and with liver problems, and they find that you have this cholestasis or reduced bile flow in the liver, they're going to give you one or two drugs, and one of them will be TUDCA. 10 to 13 milligrams daily has been shown to improve liver regenesis rates in a clinically ill population. That might be the lowest active dose. When looking at improving bile salt composition, the usual dose is 15 to 20 milligrams per kilogram of body weight. It's for treating insulin sensitivity in the obese but non-diabetic men and women. A study showed providing 1,750 milligrams daily for 4 weeks improved muscle and liver tissue insulin sensitivity, but not adipose or fat tissue. In other words, it improved the insulin sensitivity of muscle and liver, but not fat. And it also, as a result, it had no effect on fat loss. It just increased insulin sensitivity. It was about a 30% improvement, which is equal to what usually occurs when you take certain anti-diabetes drugs, such as thiazolidinones and metformin. So it's comparable. However, I think metformin would be a better drug to use for insulin insensitivity. That is the main drug given for so-called pre-diabetes to treat insulin insensitivity. Benefit, like I say, it can also be TUDCA can also be because of the fact that its effect on thinning out bile. It can help to dissolve gallstones. Now, gallstones usually are made of basically bile that is basically hardened up. They usually occur in women that are over 40, that are tend to be obese, but they can occur in anybody. They frequently occur in people that, let's say, people that have a lot of body fat, that lose weight rapidly. They tend to get gallstones. TUDCA can help dissolve gallstones made from cholesterol. Gallstones are usually made from cholesterol, the majority. Some of them contain calcium, however. The gallstones that contain calcium will not be affected by TUDCA, only the ones made from cholesterol. Now, as I said, TUDCA also has some beneficial neurological effects. It shows some protective effects against the onset of Alzheimer's disease. One way it does this is by reducing inflammation of certain structures in the brain called microglia. When microglia get inflamed, they're associated with the onset of Alzheimer's disease. And some preliminary animal studies, a brand new one just came out recently, showed that administering TUDCA to rats will actually reduce the inflammation in the microglia, which is a forerunner for Alzheimer's disease. Again, this needs to be proved in human studies. So far, it's only been shown up in animal studies, but it's an interesting effect. TUDCA also has an effect on thyroid hormone in animals. Again, another animal study, it showed that it helps to convert the inactive T4 form of thyroid into the 5 times more active T3. Now, if that holds true in humans, TUDCA might have a slight effect on helping reduce body fat by optimizing thyroid production. However, as far as I know, this has never been tested in humans, but it does occur. It does occur in lab animals like rats. Another study shows that, again, animal studies show that TUDCA, again, because of its bile emulsifying effect, it seems to help reduce suppress the development of colon cancer. One theory of what causes colon cancer is excess bile acids, which irritate the cells lining the colon, which causes them to mutate and become cancerous. So again, if you can keep the bile moving, there's going to be less irritation to the colon cells, less chance of colon cancer. Another animal study showed that it was a rat study. It showed that providing TUDCA increases the activity of insulin-degrading enzyme in the liver of obese mice. What's interesting about that particular study is insulin-degrading enzyme in the brain has it not only does it reduce insulin levels in the brain, but it also reduces levels of a protein called beta amyloid, which is one of the 2 main proteins associated with the onset of Alzheimer's disease. In fact, this is why studies show that people with diabetes have a greater tendency or proclivity to get Alzheimer's disease because the excess insulin in the brain, the insulin degrading enzyme, which would normally help to clear out beta amyloid, is so busy getting rid of the excess insulin that diabetics have in the brain that allows the beta amyloid to build up, and these diabetics wind up with Alzheimer's disease. Now, if TUDCA can get into the brain, it can get past the blood-brain barrier, which protects the brain from substances. I'm not going to get into that, but let's put it this way. TUDCA can get into the brain. Now, nobody's tested this, but if TUDCA can get into the brain and they can upregulate or increase the activity of insulin-degrading enzyme, it might have a very potent effect at preventing Alzheimer's disease, especially in people with higher insulin levels or insulin levels that are a little out of whack, like with people with diabetes or prediabetes. The final study I talk about, a recent study showed that TUDCA is involved in bone regeneration. So it could be, again, animal study, preliminary, but if that again holds true in humans, TUDCA can have some use in possibly preventing bone-wasting diseases such as osteoporosis, which is very common in small women with small bones. Starts at age 30, usually shows up clinically where you get symptoms at about age 60 or so, where you get spontaneous fractures, hip fractures, that type of thing. So basically, that's about it for TUDCA. I just wanted to mention this because I thought it's an interesting compound. And I think based on the research I've seen on TUDCA, I think it would really be a good idea for anyone using oral steroids. And because let's face it, people who use oral steroids are not going to use the medically indicated doses. For example, Dianabol, methandrostenolone, when it first came out, the dose was 2 tablets a day. That's 10 milligrams. And, right away, as soon as bodybuilders got a hold of it, they started using 20, 30, 40, 50 milligrams. Now, if you take 2 milligrams of Dianabol, you're not going to have any problems with any liver problems at all, unless you take it for 40 years or something like that. But if you start to get like 25, 30 milligrams or more, you're likely going to get the cholestasis effect. You're going to get the inflammation of the liver. In that situation, it's really good to have a bottle of TUDCA on hand. I would suggest that anybody, who uses oral steroids probably doesn't take the suggested medical doses. They're already probably taking larger doses, in which case there's a really good chance that you're going to get some degree of cholestasis. Again, you have 2 ways of treating this. One is to just get off the oral steroids. If you do that, the cholestasis will recede, the inflammation will recede, your liver enzymes will go back to normal. You don't have to take TUDCA. You don't have to take anything. In fact, that's probably the preferred way to do it. Have your blood monitored, your liver enzymes. If they're starting to go up really fast when you take oral steroids, just get off them. If you get off them for a couple of weeks, your liver enzymes will go down, the inflammation goes down. You don't have to do anything. But for those hardcore types, who believe in that, you could stay on doses of oral steroids year round, I would strongly suggest, or wait, if you just take oral steroids for a short time, but you're taking larger doses, you're taking really liver straining oral steroids such as Anadrol, or what's the other one called? I can't remember the other one, but there's another one. Basically, they're really tough on the liver. If you take those particular steroids, again, you should have a bottle of TUDCA on hand, because you could start to have liver problems in as little as 3 to 4 weeks. The enzymes will go up. So again, it's called TUDCA, TUDCA. I'm not involved with any companies who sell it. I'm not going to recommend any particular brands. I know that I've seen it sold on the internet. I couldn't verify the quality of it, but it's no big deal. It's not like it's a complex compound. So, I don't think there's a question of potency involved. I would say to go with the least expensive brand you could find. And again, keep it on hand if you're taking the more powerful oral anabolic steroids like Anadrol, or if you're taking larger doses of oral steroids, or for some reason you want to stay on oral steroids for more than 8 weeks. You should always, keep TUDCA on hand. It will go a large way in preventing the inflammation That's the main side effect of oral steroids, and is the effect that eventually causes severe liver problems. So that's about it for TUDCA. If you want to have the most in-depth, accurate, evidence-based information on nutrition, ergogenic aids, anti-aging research you can use today, hormonal therapy, food supplements, which ones work, which ones don't, women's health and fitness, exercise science, ergogenic aids. Subscribe today to my Applied Metabolics newsletter, www.appliedmetabolics.com. When you subscribe, it's 40 to 50 pages every month. There's no ads. It's based on my over about 58 years of constant study and also empirical experience in the gym. I know what works. I know what doesn't work. I'm going to tell you in this newsletter. I also discuss fat techniques, fat loss techniques, which ones work, which ones don't, all in my Applied Metabolics newsletter. If you subscribe, I'll send you an invitation to join my private Applied Metabolics Facebook page, where every day I post new data, new research on exercise, general health, fat loss, and nutrition every day. It's only for subscribers. I have an email portal on my Applied Metabolics site, strictly for subscribers. You can send me short questions. I don't answer unsolicited questions. I just don't have the time. You're welcome to leave comments under these videos. There's a slight chance I might be able to answer some of them. Not likely, though. I do answer questions, however, submitted by paid subscribers to my Applied Metabolics newsletter. So what can I say? That's about it. And by the way, I just want to add a little brief editorial. You know, speaking of steroids, since I talked about steroids a little bit indirectly in this video in relation to TUDCA, I just want to say that I think that people who use steroids that have no intention of competing in any bodybuilding or athletic competition, it doesn't make any sense to me, because, you know, don't ever believe for a second that steroids are benign, that, you know, you can take them in small dosages and nothing will happen. You really can't predict what's going to happen because of genetic differences. You know, you can't really predict what's going to happen when you take steroids. Don't think steroids are safe. You know, you can get you can make tremendous progress just by good nutrition and exercise. So, you know, again, I think I'm sorry, I think it's almost stupid for somebody to use steroids that has no intention of competing. It makes no sense to me at all. All right, that's my little rant. I just wanted to say that. But I will say this: if you want to have the best friend you'll ever have, go to your local shelter, adopt a dog. They're sweet, they're lovely animals, and they're the most loyal animals on earth. I've said it before, I'll say it again. Everybody in your life could abandon you, your wife, your family, your siblings, whatever. Your loving wife who loves you to death could divorce you in 2 years and want to cut your testicles off. But I guarantee you, no dog will ever even think like that. The dogs are 100% loyal, 100% loving, and they'll remain your best friend to the end. So go to your local shelter, adopt a dog, any dog, big, small, makes no difference. Take care.